Anglo Afiadenyigba Health Center enye doyofa ike le kuhe gandama ike ameuke lafma le hahama ike opokoko na dwaja ba wa ba pere yo na yuaja gba Health Center ado prosusu watia hwamo wo le fukpepe gandawo ma ike ofe physician assistant adamane Everlove TV kuda enu yo ke ajiyim lafma ike nu yo ko yo jijim cho dwaja gbo ba yo akọ awodo enye nu ike ewo mblani le gapopo ya ma.
My name is Juliet Amavi Anaglo. Currently, I am in charge of Anglo Afiadenyigba Health Center. I am a principal physician assistant. Posted here January 2022. When I came, there are a lot of challenges that I came and met. Challenges with staff. The major one is the community don't patronize this facility. Our population, 2023 population was 9,000, almost 10,000. This 2024, they reduced it to be 8,999, almost 9,000. But the OPD attendance is very low. The first day I came, we saw only 5 clients. And I'm trying to find out why. I asked their population, they mentioned, I said, why are the people going? So I started doing home visiting myself. I entered the community to interview few people. And what they told me, I wasn't happy. Staff attitude towards them is one, and a lot. So I started with community engagement, organizing community debates, going to churches, funerals. I attend almost all the funerals in the community. Then I asked permission for them to give me some 5 minutes to give talk. So from there, and then there are 2 community information centers in the town. So I use them. I go to Sun City Radio to go and beg them that they should patronize the facility. When you ask them, they go far to Akachi, they go to Jadokpo, they go to Abo, and now that they have this new hospital, they go there. And they will be here, they take motor and go. So I managed to address those issues. So we started our OPD attendance increasing. 2021 data that I saw, the whole year was 4,000 something that they saw. So 2022, we increased to 7,000. In 2023, I hope I think 10,000 and over. So I am happy to say by the end of 2022, I received this award. We have 2, the best leader and then the best performing facility. Personally, I didn't choose to come to Afiadenyigba. I applied for Anyako. But when I came, my district director told me, no, we have a bigger facility here, which is almost collapsing. So with my experience, they will change my transfer to here. So I've agreed. So I know there's a task ahead of me. So I started, and we make some improvements. When I came, the facility was operating as a chief's compound, managed by a midwife. So that is the major one. I said, no, with a PA, we can upgrade to a health center level. So we started engaging the health insurance people, engaging the community, that before they will upgrade us, they will see our OPD attendance. If the place is upgraded and we are seeing 5 people, 10 people, no government will waste its resources to do that. So in that process, at the end of 2022, we are upgraded to a health center level. Now our next step is to become a polyclinic. This place is very big. So a hospital there we can't get because we have surrounding hospitals. But a polyclinic, there are certain basic things that we refer people to go to hospital and do. We can do it if we reach polyclinic level. So based on that, we are crying. As I told you, I use Sun City Radio a lot. And then I engage the community, the chiefs, the assemblymen, the opinion leaders. And I said the idea for them that I have only 4 years to retire. So they should buy this idea for me. And then, in fact, I am proud that director didn't make a mistake posting me here. The community is very, very supportive. The first donation I received in this region from a family. I was asking them, so, yes, so tetanus injection, those things are supposed to be in the fridge. Where do you keep them? We were doing some things. So this is the first donation that I received. I received from the community members in this fridge, which is serving us our suppositories, tetanus injections, and then we put it in. And then, as I was saying, I met a structure, lab, well-level laboratory, and I have a lab technician. But microscope is there, you can't use it because the dust, no AC. So when you take blood sample and then lorry pass and blow the dust, how can you get quality this thing? So we just there doing malaria test that simple nurse can do. So I told them we can lobby. So through lobbying, somebody who is not even from Afiadenyigba, he heard our cry as sensitive. So he sent somebody from Agbozume to come and look for me and look for the assemblyman that he heard about our problem. He bought beds from abroad and he want to give some people beds. Our cry touched him, so we should come to Accra to come and take the beds. So our assemblyman, by then, we arranged it and then quality beds. And then he bought that flame, something glass that we use now. So now we got a donation too from a community member, AC. So as for the lab, he's using air conditioning. Then we can run a lot of labs. So those are some of the success stories. So with our cry in the community, it's people heard it afar. Community members, both home and abroad, they do support us a lot, especially the community Deba. When I came, there are a lot of staff, so I didn't bother them. But at the end of 2022, this abroad going thing, most of my nurses have left to abroad. And some also said they are going to join their husband. So that reduced our staff strength to 14. But the community Deba is benefiting the people because I went to health insurance people. I told them, my people, they don't have money. So that is why they are not getting TNT to come to Keta to do the health insurance. And when they come, they don't have money to buy. Now that they are upgraded to health center, there are a lot of medicines that they used to buy formerly. They will not take it free with the health insurance. So we agree. So every 3 months that we organize the quarterly Deba and outreach, health insurance people come to do health insurance for them free. 27th June, we did the second quarter, massive turnout, and they come and renew and enroll them free for us. So that one is also helping that those who say, I don't have money to come, now that you have the health insurance, and you come and take medicine free, what will keep you in the house again? And the community support us with food. When I ask them that, the people that are coming, I have to feed them. So they give us money, they buy water for us, drink, canopy chairs, they give to us free, and then Togbi Akamu, MP, they release their car for us to convey the medicines and everything. When we close in the evening, we call them, they come. So actually, this community, I don't know how I can praise them. If they post you to a community like this, you have a vision to upgrade the place, and you sell it to the opinion leaders and the community members, and they saw that it's good, and they are supporting. I mean, you also like to kill yourself for them. So me, I started my nursing from orderly community health nurse, SRA, before I became a PA. And public health is my priority. So I don't sit in, you see my home visiting bag. I go to the community, some aged, they can't take even motor to come. So every Saturday, I visit them in their home. Check their BP, check their BP drug. So all the medicines are in there. Those that, you see this box, all my aged, their OPD card is here. So when the medicine is finishing, they will call me, your name. Then I pick it, I pick your folder, I make the medicine, is there, I come and give to you. And so every Saturday is my home visiting time. So those are the success stories. But that doesn't mean, yes.
Afiadenyigba lolola enunye wawasia miatokyo jowo beya keneleksa wenami edonye blewo hanji be miawo miatosinu nuvevye nyanya di dodo klameso.
My first challenge is the human resource. You see, all these interventions, I need human beings to work with me. So when I came here, I don't disturb people. But as they left, last year I have to go to UHAS, bonuses training, catalysis training, that they should be sending me students for practical. So the whole 2023 for my community engagement program, it is the students that I use. And catalysis training helped me a lot. When I go, they say, oh, no problem, they are also learning. But this one that we did, the students are on vacation. They sent some for practical. They didn't give me. I went to UHAS, they said no. So what do? We thought we can use science students at Afiadenyigba. They agreed when they say, hey, it was Thursday, not the weekend. They will release the students. Somebody will just take phone and test to their GES. Students that's supposed to be in classroom. So 3 days to the program, they also disappoint us. What do? Assemblyman, what do? They say, why should you worry? Their children are there. Some attended the necessary training, are waiting for posting. Some attend secondary school. Writing people's name. We teach them how to check BP and co. So they gave them 8 ladies to me to train. So I used that 3 days to train them, and then they helped me. So Women Resource Challenge is number 1. Then number 2, we are moving from this paperless thing to computer. I will show you our records. As we are using folder, the place that we are even filing the folders is even choke. I'm now begging them to come and make another shelf for us. So, but when we have a computer, maybe a laptop or tablet, and we put in their information, immediately the person mentions the name and you kick in, it will pop up, you see. So we need laptops so that at least we can also go with the modern one than this folder. These old ladies, that is why I'm keeping most of them their folder. They will come with the health insurance. For that one, there is quality. But the paper, they don't know where they put the card. So you will now go and be looking through registers. When did you come? You can't even remember the last time that you come, that you go to that mate and say, so we need laptop so that our data, we can also be putting it in. So I'm saying this shelf that you are seeing here was donated to us by community members. Their names were written on it. When I came 2022, the folders are packed in cartons, some on tables, on the floor. There's no place to pass here to go and sit at that table. So, community engagement, one of the funeral, we went and I pleaded with them that if you come and you don't want it to waste time for you, please do something for it. I did that. You put your folders in. And within 3 months, this family made these 3 shelves for us. That's why you are seeing our record nice like this. And that's why I'm saying it is also getting full. We are not doing electronic, so we need more shelves. We are using only 1 room for detaining patients, both male, female, children. Somebody misses, you want to give injection. So when we have the bed, and the MP also gave us some mattresses, we created, there's a room that we do our claimant. There was 1 desktop that we have. So we put some of the bed there. And our procedure room here to put some 2 beds there, that at least we can be separating the men. But we need structure. Now that we are thinking we want to upgrade to a polyclinic, we need rooms for detaining male, female children. Not only 1 room that we will be managing like that. And the road. The dust is disturbing us a lot. You see, my uniform, I wear white. You can even see this one. If you come, the next day you can't wear the uniform again. The speedy vehicles, they will just be blowing the dust. That is why we saw most of our teams so dirty like this. So I went to MCE and he told me for the road work is a problem. So I said, okay, then they should come and do speed ramp. Because when they apply, we are begging them that lower the speed, they just laugh about. If you do speed ramp, it will control them. So that the facility will not be so dirty like this. That is a major one. Then we need air conditioning. Now we have one at the lab. That is okay. But if you look at our store, when I open it now, our medicine needs to be in a cold environment. This is our pharmacy, the same dispensary. You see these medicines here. some suppository that they insert. It's supposed to be in fridge. So here too, we need fridge. And we need AC because this medicine is supposed to be in a cold environment. So we need fridge here and we need AC too, so that our medicines can be well preserved for our clients. The heat alone, so it's only God who is helping our people. So consulting room, the store and the pharmacy, we need AC there. Other offices we can use fan. But for our medicines, the store, the consulting room and the pharmacy, we need AC there. We need a lot of urinal. If you see where we are, we just put some roofing sheet there. Clients also go there and do what we go and do. So as I told you, one of our bigger challenge too is about washroom. Washroom for staff, washroom for clients. In some ways, I feel ashamed when I'm showing this, but that is the reality. This structure you have seen here, we use roofing sheet to do, is the washroom for we, the clients and we, the staff. When we are attending to clients and we feel like urinating, this is why we come. When the lab man wants a client to come and produce urine and bring for test, this is where he come. Last year, health insurance people nearly bring us down to chief's level again because of the washroom. They said it means we are not providing quality service to their client because clients cannot come and be using here. But we show them where Tobia Kamu is doing. So we promise them that by the end of this year, they will come and see. Yes, this is the washroom that he's building for us. So when I came and had, they show me. So every day I am on Toby. Every day I'm on Toby. They will say, oh, you do. So we are just praying that that one should be there. Other than that, I'm afraid 2024, when health insurance or any authority come to assess us again, and they are seeing that this is the place that we are still using, we, the staff and the patient, we are still using this for urinal. I'm afraid the polyclinic that we want to go will rather come backwards to Chief's compound level. So this one too, I'm appealing to the general public that they should come to our aid. We need washroom for staff. We need washroom for clients. Have you seen this public toilet? When a client come and you want to ease yourself, that is where he go. Last month, a client is going there. He met a snake. He ran and come back to us. So, I mean, it's also a major challenge that we are facing, both clients and the staff. When we have washroom in this facility. So those are the major challenges that we are facing. So I'm saying we need vehicle or at least motorbike for our home visiting because the Okada boys are charging us too much. Some aged, if you go club, nobody have anything to give you. But their children outside Accra, then they will one day drop money for you that way. So when we have our own motorbike, we buy fuel. We will do a lot of community activities. So I'm happy. I don't even want to go to the Anyako again. I don't want to go to the Anyako again. Now if they tell me, I tell them no. I'm okay with my people. I'm okay with them.